Hello again, everyone. My name is Marty Guthmiller, CEO of Orange City Area Health System. Welcome to the 28th edition of our COVID-19 community briefing. Kind of an abbreviated report today. I have some stats that we'll go through. Most all of them are positive, positive being as in more negatives, if you will. So we'll just jump right in and go with our local scoreboard. And we have completed, again, this would be tests that Orange City Area Health System has conducted. 361 tests, 29 of those are positive for a positive rate of 8.0%. So our rate of positive continues to be almost identical within that 7.5% to 9% range. 8% positives. We do have 17 tests that are pending, but again, that's normal as we are testing all same day surgical patients as well. So things pretty much normal on the Orange City front. On the Sioux County front, we had 331 positives, 331 of 1,833. So that represents 1 out of 19 Sioux County residents that have been tested. Positive rate is 18.1%. That has been coming down, although slightly since Monday, at 18.2%. So at least heading in the right direction. And again, a point to remember, we've had 0 deaths in Sioux County as a result of COVID-19, and that's obviously a very good thing. I did look at stats a little bit closer, and this is something I haven't mentioned before, but kind of goes along with the 0 deaths in Sioux County, and that is that 81% of those 331 positives have been between the age groups of 18 and 60. So that gives you a little bit of idea where the positives are coming from in terms of age demographics, and also coincides with the 0% death rate at this point in time as well. Region 3, expanding out a little bit to the 20 counties in Northwest Iowa. We have 75 currently hospitalized as of this morning. That number when we spoke on Monday was 80, so a nice drop there. In the last 24 hours, Region 3 has admitted 3 patients. When we talked on Monday, that number was 5. Region 3 currently has ICU patients numbering 29. That number on Monday was 32. And so very recently was in the 40s. So good things on a little broader range as well. Iowa has 22,454 positives out of 202,594 tested. That is 1 out of every 16 Iowans now have been tested, with a positive rate of 11.1%. So that rate is coming down a little faster than our Sioux County rate. That rate on Monday was 11.4. So as of this morning, our positive rate in the state of Iowa is 11.1%. In terms of local hospitalizations, out of the total number in the state of Iowa of 245, so again, 245 at a state level is a number coming down as well. Sioux County has 0 hospitalizations, as I've mentioned. Plymouth County has 3. That number is unchanged from Monday. Lyon and O'Brien County remain at 0. Woodbury County down to 34 from Monday's number of 39. BV County still in the thick of it. I mentioned the outbreak that's in BV County. They've actually went up to 23 hospitalizations in BV County, and that was compared to 21 on Monday. Polk County in Des Moines continues to inch down a little bit at 72, and on Monday I reported that they were at 73. So generally speaking, good news. If it wasn't for Storm Lake at this time, the numbers would be even significantly better, but yet overall, very good signs out there. I've mentioned senior care guidance coming out. That in fact did come out, and we've been looking through it. There probably will not be a significant change, at least to families or to senior care residents that are visible or known at this point. It's likely the first part of July before we are going to be able to move to the next phase of visitor policies there. We are anticipating the first week in July-ish, first part of July, that there'll be some relaxation. All of that will be subject to nothing happening between now and then. And the state does allow, if you go 14 days without an incident, without any significant event, you can consider moving on. So that does come into play a little bit. So we're looking at the first part of July, perhaps as the next visible thing that changes to a large degree in our senior care. I'd like to mention again that we have relaxed visitation policies somewhat in the hospital and same-day surgery areas. Generally speaking, you can have one person as a designated visitor. Unless you're a pediatric patient, generally speaking, you can have two people, mom and dad, as an example, for peds patients. So generally speaking, good news. On a personal side of the equation, it seems like I'm hearing of more people I know who have tested positive, but again, that's at a personal level, not at an institutional level. And so these numbers are really good numbers. We are going to experience, we're all going to know more people that have been either exposed and or actually tested positive. One of the theories that I heard 2 weeks ago after the Memorial Day weekend parties and things like that you see around the country is that expect a few more positives coming out of that 10 days to 2 weeks later. Well, guess what? We're in that period of time now. We are having a few more positives. Again, in Sioux County, it's mostly between the ages of 18 and 60. The acuity levels seem to be a little bit lower, fortunately. But having this, the exposure of the parties and this and that on Memorial Day weekend, and with the protests going on, we may see more as coming out of a result of close proximity of people in those areas too. So interesting times for sure. The numbers generally are good and they feel better because they are. And so we'll continue to relax things as we can to get back to normal as quickly as we can. And thank you for trusting us to take care of you in times like this. And I just have to remind you again to stay vigilant, to stay strong, and stay healthy. Thank you for joining us today. Again, we appreciate the trust and confidence you have in Orange City Area Health System and all the great people that work here. Thank you.